Mike?
We tend to run in the same circles. A lot of us, when we hit these meetings and focus groups and all manner of planning and such. I'm wondering from anybody on the panel or several of you from the panel, how would you say that we need to convince the average citizen that investment in downtown is the right thing to do, and also to what you see both through your individual experiences and what you hear from your employees and maybe customers, what are those things that we need to do with downtown to get people to come back in whatever form, if that's living, if that's shopping, if that's opening a business, or whatever it may be. Downtown Springfield is pretty accessible from just about any part of the city, but I think if you look at it, the lack of private investment, we've had a lot of public investment, but the lack of private investment has lacked both in businesses and living accommodations. And I'm wondering how we get the average citizen to get excited about downtown again.
Well, I'm going to speak obviously from the living piece of this and the neighborhood piece. And the one thing that we have to recognize is even though we hear over and over again about the glut of housing, and we have too many houses in our core cities, what we have is a glut of houses that have really lived beyond their useful lives. They are older, without the amenities that today's home buyer is looking for. So we really have to start to provide a supply of houses for today's home buyer. And when we start to recruit that home buyer, I don't think for a minute that we start with families with kids necessarily because of the school issues. I think we look at niche markets. I think we look at the college graduates from Wittenberg University and try and, first of all, stem the brain drain. I think we look at empty nesters and we start to bring middle-class families back into the city, create really interesting social fabric in neighborhoods that seem comfortable, and before we start to necessarily bring families back with kids. We had, some of us worked with a focus group with a very high-tech industry, high-paid employees, very sophisticated, and the one question we said is, what's the issue with you living in town? And of course it's education. My kids are grown, I still don't want to live in a place with bad schools, but what we heard is if we had incentives for higher education for our children, we would invest in a heartbeat. Something for consideration.
Well, as you may know, there are a bunch of people in town who've been talking about that, some version of Kalamazoo Promise, so I think we agree with that. My own view is we need to talk to as many people as possible, but the vast majority of people in Springfield are not going to believe it until they see it. And I think they will begin to see it, and that will make a dramatic difference. The results, I think, will sell the future, and it's very difficult to convince them. I mean, probably a major portion of this community never thought that they'd be pouring concrete where that new hospital is going to go, until they saw it happen. Now they believe it, and I think that's what will work.
Just to add to that, there's a lot of health care that is being provided to residents of Springfield and the surrounding communities, not in Springfield. And I'm very optimistic, and I believe that with the benefit of the new healthcare facilities in downtown Springfield, with an added increase in emphasis, and the quality, the public will hopefully want to come back and receive their health care in downtown Springfield, and that's going to have a very significant positive economic drive for all aspects of our economy. And again, we're not talking about new business, we're talking about re-earning the trust, the confidence of business that is originating here in our community and going outward, just keeping that back in our community, and I think that will help a lot of what we're talking about.
All major roads lead to downtown Springfield except for Route 235. We are on the cutting edge of many great opportunities. We have over 1,000 people living in the core area. This puts you within 1,500 of the 2% statistic that you mentioned out there of our population. So the potential's here. The Hotel Shawnee just spent $17 million in renovating. And there are numerous other projects along the edges like this. It is important that we attract taxpayers to the downtown area and grow our real estate base for the good of the schools also.
Okay, so what do we need? We need a downtown stadium-seated movie theater. So if anyone is willing to develop that in our downtown, see one of these people afterwards. But we really need that to really be a catalyst for some of the downtown development.
We'll do it.
Rick's gonna do it soon.
Now we know what the Savoy is gonna be.
Can be part of your hospital, right?
Some hospital, I'm not sure.
Questions? Yes?
With the extensive,
Can you stand up, please?
with the extensive efforts to bring in businesses to the business parks, the high technology, that sort of thing, what specifically is being done to attract and support micro businesses, mom and pop shops, the Fountain on Main, bistro, things like that in downtown, where we talk about private investment, there's a lot of people in downtown that are already investing their money and sacrificing to be downtown. So what are we doing to bring those types of businesses and keep them in downtown for the extended period as this growth happens?
Sean, I'll start that out. You know, I believe as we grow our economic base here in Springfield, that will happen. We just need to bring new jobs. We need to continue to create job opportunities for people in Clark County, and as that happens, these downtown businesses will grow. You've heard about the plan for downtown. That is the focus. And is it going to happen tomorrow? No, but as we build these assets, the ice arena, the hospitals, the park, the associated development that will take place around that, as we gain traction or gain inertia of private development to happen with these institutional developments that are happening now with this public infrastructure, those businesses will begin to thrive. Right now, they're trying to survive, but as this vision begins to take traction in our community, you'll begin to see those businesses thrive, and you'll see other businesses growing, kind of like the bistro. You know, that's just kind of another step in that direction, but we have a lot of work to do in that area. But as we create new job opportunities in our communities and as we build this infrastructure, we're setting the landscape for those type of companies and type of businesses to thrive in this environment.
I truly think that the two hospital projects are the first dominoes which are going to lead to people to see this is where I want to go put my business up. There will be, on the outpatient surgery centers in town, do approximately 12,000 surgeries a year. How many admissions does the hospital have?
17,000.
17,000 admissions to the hospital per year. Then you take the patients and the patients' families, you're talking about hundreds of thousands of visits to downtown after 2012. You won't have to incentivize people to build, I don't think. To me, it's going to be a natural progression is you're going to put businesses, cafes, restaurants in a place where you have high patient flow. And I'm not a business person, but to me it makes pretty good sense that this is where we're having thousands and thousands and thousands of people migrate to for a need for health care. Those businesses will come.